Hello everyone! Today we will talk about how to get ready for your hydrogen breath test. First of all, we are doing this test to find out if your child has lactose intolerance. But what exactly is it? Well, some people's tummies don't like milk or foods with milk in them. This happens because their body have trouble breaking down a sugar in milk called lactose. When you eat or drink dairy, you might feel gassy, bloated, or you have a tummy ache. How can we find out? We ask your child to take a special test called the hydrogen breath test. It would help us see if their body is having trouble with lactose. What is a hydrogen breath test? It's a test where they breathe into a special tube. After they drink a drink with lactose in it, we will ask them to breathe out into the tube at different times. The tube helps us check if their body is having trouble with lactose. How does this test work? When your body has trouble with lactose, it creates hydrogen in the breath. We will measure the hydrogen to see if it's higher than usual. If it is, it means the body isn't breaking down lactose properly. What should you do before the test? Well, there's a list of medications they cannot take sometime before the test. This is very important, otherwise the test would not be accurate. 4 weeks before the test, no antibiotics, Pepto-Bismol, antibiotic herbals, bowel cleanouts, probiotics, and lactase enzymes. If your child needs to take one of them, the test can be rescheduled. Now, 1 week before the test, no laxatives, no motility agents such as Reglan, no fiber supplements, antacids, or proton pump inhibitors. What should the child eat the day before the test? There's the list of foods they cannot eat on the day before the test. No beans, no sweeteners, seasoning, dairy products, no grains, no food with high fructose syrup, no fruits, no vegetables, no sodas, no juice. It's just easy to adhere to a list of what they can actually eat. And the list is short. Only baked or boiled chicken or fish, salted pepper, eggs, chicken broth, water, coffee, and tea. Complete fasting 12 hours before the test. If they really need to, you could give them a glass of water. And 1 hour before the test, no sleeping, no vigorous exercise, don't jog to the exam room, no gum, and no candy. And finally, what should happen during the test? It's very simple. They will drink a special drink that has lactose in it, a little bit sweet, but they'll like it. And then we will ask them to blow into the tube. After they drink the lactose, they will blow into the tube a few times over the next 2 to 3 hours. It's easy, it doesn't hurt, no blood work, no shots. You could tell your child it's okay to be nervous, but they're brave. The test is simple and they can do it. If they have lactose intolerance, we will help them figure out how we can make them feel better. It's just one step toward making their tummy feel happy again. Here's the number if you have any questions, and thank you for listening.